The new vaccine superstations opening around the county, the latest from local leaders on getting San Diegans protected from the virus. Plus, President Biden not wasting any time tackling the pandemic. What his chief medical advisor said about the administration's different approach to COVID-19. And the local team that wants to make San Diego the soccer capital of North America.
ABC 10 News at 4 starts now.
1,800 people are getting vaccinated at the county's South Bay Superstation today. The county just wrapped a news conference that focused on its new superstation and plans for more. Good afternoon. I'm Kimberly Hunt. And the site just opened this morning. Appointments were fully booked. ABC 10 News reporter Jennifer De La Cruz explains what you can do to increase your chances of getting scheduled.
South Bay residents jumping and waving at our cameras, thrilled to be getting vaccinated at the county's newest superstation. The site at Broadway and H Street in Chula Vista was filled with people who fall under Tier 1A, which includes healthcare workers and people over 75. Sharp Healthcare VP Scott Evans says things were running just as planned.
It's been extremely smooth. There's actually very short queuing for people that have appointments, and they're actually moving through quite rapidly.
It's the third vaccination center Sharp is running in San Diego County, so Evans says they've dialed in their system.
There's not really chances of major vaccine expiring. We have a pharmacy team that is running the vaccine preparation, and it's based on queuing signals and lines and appointments and highly orchestrated. And they're just doing a great job.
They're starting out with 1,800 appointments per day and plan to move up to 5,000 a day by Tuesday. The county is hoping to get to 25,000 vaccinations per day once they add additional sites in February. County Supervisor Nathan Fletcher says they only have a limited supply of doses, so he's asking for patience.
We know in some cases there are instances of traffic and backups and people having difficulty getting appointments because they aren't available. But again, this in large part is a testament to the demand.
Although the South Bay was fully booked for opening day, some lucky people were able to snag last-minute appointments.
She said they just kept refreshing the site this morning, and they actually were able to get an appointment an hour ago and then rushed down here and got her grandmother vaccinated.
The site will run from 10 a.m. to 7 p.m. through Saturday and 10 o'clock to 5 p.m. on Sunday. Jennifer De La Cruz, ABC 10 News.
You can make an appointment to get a vaccine at the Superstation online. We have a link on our website, 10news.com. Here are the latest local numbers with the coronavirus. More than 1,100 new cases reported today. That brings our total to just under 220,000 people. The county also reported 48 new deaths. More than 2,200 San Diegans have lost their lives to COVID-19.
President Biden has a goal of giving 100 million COVID vaccinations in his first 100 days. FEMA is now working on community vaccination centers with the goal of having 100 ready in the next month. Biden also signed a number of executive orders today to help work towards that vaccination goal. Now, the big one is using the Defense Production Act to accelerate manufacturing and delivery of supplies for vaccines, tests, and PPE. President Trump had also used the act to create more masks and ventilators. President Biden is also establishing a board to expand the supply and access to testing. Airports and airlines already require masks, but now there will be an executive order requiring it as well. Another executive order calls for more data collection on who is getting the vaccine and where there are disparities. All of this comes at a critical time, as some states and cities are reporting shortages of COVID vaccines, forcing some to reschedule appointments. New York City's mayor is warning they're going to begin to run out today. He says they had to reschedule 23,000 appointments for people waiting to get their first dose because they didn't have the supply. Part of the issue is there was a delay in this week's delivery of Moderna's vaccine. West Virginia also says it did not get an increase in doses that it was expecting this week. It has already administered nearly all of its first doses.
I do think that the release of vaccines, the allocation of vaccines from manufacturers into the states, which is dictated by CDC, I think that's lagging a little bit. But I think what you'll find is that as it catches up, you're going to see those numbers change. And I think you'll see less and less places complaining that they have a vaccine shortage.
LJ Tan is with the Immunization Action Coalition, a group that works to increase immunization rates. He says it's on states to make sure they're monitoring their supply so they know there will be supply for second doses. He also says there needs to be better communication to states about how much supply is coming and when.
I'm actually fairly confident that that there will be supply. Everything that I've heard from the manufacturers suggests that over the course of the next few months, there will be supply to match the ramping up of the program.
Around half of the nearly 36 million doses distributed to states by the federal government have been administered so far. Tan says the money in the latest stimulus package to help with vaccine distribution is just starting to get to states.
President Biden is wasting no time trying to tackle the coronavirus pandemic that's killed over 400,000 Americans.
We're in a national emergency, and it's time we treat it like one.
As part of the Biden administration's national strategy for getting the pandemic under control, the president signed at least 10 executive actions today. Part of that strategy is using the Defense Production Act.
Our national plan launches a full-scale wartime effort to address the supply shortages by ramping up production and protective equipment, syringes, needles, you name it.
One of the things that we're going to do.
Dr. Anthony Fauci, now Biden's chief medical advisor, believes the U.S. may be able to surpass the president's goal of 100 million vaccines administered in 100 days. House Speaker Nancy Pelosi says that she's eager to get Biden's COVID relief bill passed. And Dr. Fauci also laid out how the new administration is going to be handling the pandemic when talking with the public. Dr. Fauci made a point to explain the differences from the previous administration.
One of the new things in this administration is if you don't know the answer, don't guess. Just say you don't know the answer. One of the things that we're going to do is to be completely transparent, open, and honest. If things go wrong, not point fingers, but to correct them, and to make everything we do be based on science and evidence.
Fauci also addressed the new virus mutations. He stressed the importance of vaccines in preventing the spread of the virus, which he said will stop any new mutations. And while we are just starting to see some hopeful signs that case numbers could be trending downward, hospitals have been overwhelmed in the recent months. And this morning, nurses briefed state lawmakers on the situation, saying they still need help. ABC 10 News reporter Natay Holmes tells us what they're calling for.
This morning, members of the California Nurses Association spoke with the state's congressional delegation, and they gave their firsthand experiences of working on the front lines. One San Diego nurse says at times they are working 60 hours a week and sometimes with limited resources.
We were not ready to have to fight tooth and nail with our hospitals to get the PPE and the resources we need to care for our patients. We were not prepared to have to come up with our own on-the-fly solutions when we didn't have adequate guidelines, appropriate training, or protections to keep us and our patients safe.
That is Shannon Cotton, a registered nurse in the intensive care unit at UCSD Medical Center. She says every day it feels like the hospital is in crisis mode. In the Southern California region, the ICU availability is at 0%. During this morning's virtual press conference, nurses say they are not receiving the proper PPE to care for COVID-19 patients.
Nearly a year into the pandemic, nurses throughout California are reporting suboptimal PPE, including being told to wear an N95 respirator for an entire 12-hour shift.
The group is also asking state leaders for widespread COVID-19 testing for healthcare workers and all patient admissions. The California Nurses Association represents nearly 100,000 registered nurses around the state. Natay Holmes, ABC 10 News.
A new study might answer some questions of how long COVID-19 immunity lasts following an infection. A research team, which included the La Jolla Institute for Immunology, may have found a clue. Their new study suggests that people with severe cases of COVID-19 may be left with more of the protective memory T cells needed to fight the infection in the future. Their research was published today in the journal Science Immunology.
We start the newsfeed with promising news about Eli Lilly's COVID-19 antibody drug. A new study shows it lowered the risk of getting COVID for residents and staff in nursing homes and other long-term care locations. The risk was reduced by up to 80% for residents. Dr. Fauci says the U.S. will resume full funding for the World Health Organization. He also says that we will join the group's efforts to get vaccines to people worldwide. Amazon is offering to help with vaccine distribution. A company leader sent a letter to President Biden saying Amazon can use their operations, IT, and communication capabilities.